Hi, my name is Emily Dahl, and I'm a speech-language pathologist who specializes in working with children with selective mutism. Selective mutism affects approximately 1 in 140 children. It's an anxiety-based disorder in which children are able to speak comfortably in at least one environment, usually the home, but have difficulty speaking in at least one other environment, usually at school or in the community. These children might struggle to communicate when someone talks to them, they might struggle to ask or answer questions, they might freeze up when they need to communicate, and have trouble initiating conversation or participating in discussions. Obviously, this can have significant impacts on their social, emotional, academic, and occupational tasks. This is a disorder that requires treatment from a number of different professionals, and SLPs are one of the people that can really contribute to this team. My book, Treating Selective Mutism as a Speech-Language Pathologist, was written to help SLPs in their treatment of children with selective mutism. People often ask me, but if SM is an anxiety disorder, should I as the SLP really be involved in the treatment? My answer is always a resounding yes. ASHA is really clear that the speech-language pathologist scope of practice includes working with students with selective mutism. ASHA outlines 12 different ways that speech therapists can and should be involved in working with these students. It includes assessing children for selective mutism and participating in the diagnostic process, as well as assessing for other underlying speech and language deficits, providing treatment to these children, collaborating with other team members, advocating for kids' needs, and also providing counseling to children and their families about communication and related topics. When I talk to SLPs about this, they often feel overwhelmed or underprepared and uncertain how to proceed with treatment. I wrote this book to serve as a treatment manual to give SLPs a guide, starting from the assessment process, through diagnosis, and through treatment, in order to help them reach this population of kids. There are a number of aspects of this book that I'm really excited about. The book features up-to-date empirical evidence about the contributing factors that can cause SM to develop. For school-based SLPs, or for any SLPs consulting with school teams, there's a section that outlines how to get and justify special education resources, which can be an area that's tricky to navigate. There's a number of tips and ideas for clinicians to use in the assessment process because it can be a difficult task to assess a child who's not able to speak in the school environment or to new people. I've also included a number of clear and evidence-based techniques that have been shown to work with children who have selective mutism, as well as specific examples of how to integrate these into the context of a typical speech therapy session. I'm particularly excited about the psychoeducation portion of this book because I think this is an area that can feel really overwhelming to SLPs. So I've included clear language and specific examples, key phrases and words that can be used to explain to kids what might be happening when they're feeling anxious about talking, why they're working on this in treatment, and why it's important to keep working on this. There are dozens of resources that are ready to use, including a case history form and interview questions for caregivers. There's also data collection forms to track progress, communication with team members forms, and activities that can be used with children of all different ages. This book includes access to a Plural Plus companion website, which allows readers to easily print and use all of the resources that are contained in the book. SLPs have such a wealth of knowledge that they bring to the table about language development, language complexity, teaching social language skills, scaffolding goals and expectations appropriately. And it's my hope that this book can help SLPs in a number of different settings, whether you're in early intervention, school-based settings, or clinic settings, to really help this population of kids who so desperately want to communicate with the people around them. Thank you so much for considering this book, and I hope it's helpful to you in your practice.